Atrial fibrillation is a very common arrhythmia. It's the most common arrhythmia there is. And what it involves is an irregular heartbeat that starts from the top chamber of the heart. Normally the top chamber beats first, followed by the bottom chamber of the heart, so top then bottom. In atrial fibrillation, the top chamber starts fibrillating, and the bottom chamber is very irregular. And it can be a very fast heart rate and irregular, or sometimes it's very slow, and it could present in different ways. Some people can have chest pain, some people can have palpitations, shortness of breath, congestive heart failure symptoms, lightheadedness, passing out. So there's a lot of different ways people can present with atrial fibrillation, but the most common is palpitations. There's also a good number of people that never feel palpitations. All they'll feel is feeling tired throughout the day or shortness of breath. So, it's hard to pinpoint, you feel this and you're going to have atrial fibrillation because, people come in all shapes and sizes. So atrial fibrillation, unfortunately, is like that. So, if somebody presents with atrial fibrillation, we want to find out what was the reason for them going into it. Common causes are aging, high blood pressure, underlying coronary disease, and one that's becoming more prevalent is actually sleep apnea. And during their evaluation for atrial fibrillation, we evaluate all of those things. Well, there's two main things that we look for when treating atrial fibrillation. Because the top chamber is just fibrillating like that, the blood can kind of sit there and form clots. So there is a 5-fold increase in the risk of stroke with atrial fibrillation. So the first thing we want to manage is, preventing stroke. Are you on the right medications to prevent stroke? There used to be basically one medication called Coumadin or warfarin that would be the only drug you could be on to prevent stroke. And recently, in the last few years, there have been other options for medications to prevent stroke. And so those have been very helpful. The other aspect of the atrial fibrillation is the heart rate. You want to get that under control too. And so there's obviously many medications to treat heart rate control, and it's, everybody responds differently to medications, but eventually we find something that works for that patient and will help keep the heart rate under control when they go into atrial fibrillation. That used to be all we had to treat atrial fibrillation, keep the heart rate under control and prevent stroke. And just with those two things, that alone can make people live just as long as somebody who's not had any atrial fibrillation. We still have those patients that even though their heart rate's under control, they still feel palpitations even though they're on the right blood thinner, their heart rate's under control, but it's irregular. And when you see that, what are you going to do about that? We usually, I guess in the past, have only put patients on antiarrhythmic medications dedicated to trying to keep you in normal rhythm. But in general, those are not very effective. Maybe 50% of the time they're effective. More recently, we've come out with a procedure called an ablation, where it involves placing wires and catheters through the veins in the legs up to the heart, and electrically isolating the veins that drain into your heart, because that's usually where the atrial fibrillation comes from. And by isolating those veins electrically with the ablation, we've had more success with getting rid of atrial fibrillation, and probably up to 70 to 80% success rate with that procedure. It's a slightly higher risk procedure than obviously just being on medications, and you have to select the right patients for it. But I think we're in the right direction as far as treatment options for atrial fibrillation. So a cardioversion, basically we place pads on your chest and we shock your heart and it resets it back into normal sinus rhythm. That's a temporary fix. That works very well right at the moment, but it doesn't prevent someone from going back into atrial fibrillation down the road. So we do use that as a temporary fix. If somebody comes into the hospital with atrial fibrillation, they're very symptomatic, their heart's racing, we can treat them right away with a cardioversion and follow that up with treating them with medications, and hopefully they don't go into atrial fibrillation anymore. But if they do have a return of that atrial fibrillation, then we can talk about either further medications or trying that ablation procedure. If someone feels that they're at risk of having atrial fibrillation or symptoms of palpitations, shortness of breath, fatigue throughout the day, or even chest pain, they really should seek out their primary care physician for further instructions on what to do. Oftentimes they'll be referred to a cardiologist if they see evidence of or concerning symptoms for atrial fibrillation, and we go from there.